Dear all, dear colleagues, thank you to the EDHF board and the administration, and especially President Corey Youngblood for inviting me to this very special event, a great initiative. You have all heard President Youngblood greeting us welcome and talked about the journey we have all been a part of as oral healthcare professionals. Today, we have a special focus on oral health in relation to the dental hygienist and our role in strengthening oral health care in the society. Corey highlighted several documents and statements related to health, general and oral health. The awareness of that we can't neglect that the oral health is a part of general health starts step by step to become normal and common knowledge when talking about health. But we all know we are not there yet. There are many obstacles to climb before good oral health during a full lifespan is something achievable for all. One of the most obvious obstacles is economy. Lack of governmental initiatives to support oral health care, especially when it comes to preventive care. But we must also admit that the oral health care professionals not always prioritize prevention. There are too many fillings and restorations that are done without any kind of preventive measures included. Too many examinations where we avoid talking about the patient's role and opportunity to reach or maintain a good oral health. There are too many care-dependent persons in long-time care or during rehabilitation after hospital care who don't get practical support with their personal oral health care. There are too many children and adolescents who don't own a toothbrush and gets necessary support to maintain and understand and carry out daily oral health care routines. And you all know there are many more examples. Today, I like to focus on what European Dental Hygienist Federation, EDHF, what we have done in an attempt to strengthen the dental hygienist profession. A profession which core business is to work with oral health care promotion, prevention, and treating caries and periodontitis with non-surgical measures and support patients with their own maintenance care. Education, the key to change and development. If it was an easy task to prevent caries and periodontitis, the cost we see today for restorative care wouldn't be as high as it is. And naturally, the personal sufferings related to those diseases wouldn't be the same. A couple of years ago, EDHF formulated a professional profile of dental hygienists in Europe with the purpose to outline the core competences and harmonize the profession. The basic structure is outlined like this. The dental hygienist is a key provider of preventive oral health care, and that goes for primary, secondary, and tertiary prevention. And this is in order to promote and improve the oral health care of individuals, families, and groups in the society. The dental hygienist shall also possess the necessary professional qualification and be able to provide patient-centered, holistic, and evidence-based practice preventive oral care independently. The dental hygienist must also possess a wide range of competences, knowledge, and skills in order to provide the highest quality of patient-centered care at all times. You can find the full document, the professional profile on edhf.com. I'd like to give you a short presentation about EDHF and the European dental hygienist situation before I will talk a bit more about education and dental hygienists. EDHF was founded in 1999, and today we are 24 countries in the federation. We represent approximately, we don't really know the exact figure, but according to the Council of European Chief Dental Officers this year, they estimate that there are approximately 54,000 dental hygienists in Europe. The profession exists in 25 countries out of 35. 2018, EDHF conducted a survey among our members. And what we learned was that the profession is regulated by law and also have a protected title in 16 of those countries. It is possible also to practice independently in 16 countries. In 7 countries, there are a 2-year curriculum for the education. In 15 countries, there is a 3-year curriculum. And in 1 country, we have a 4-year curriculum. In some countries, both 2 and 3 years programs are running at the same time. And the bachelor degree is often available, but not always mandatory. Those are examples of working environments for dental hygienists outlined in the European Commission's mutual evaluation of regulated professions in 2016. And what they saw was that the most common working environment is naturally oral health care teams, both private and public settings. Also the possibility, as I mentioned earlier, to work independently. Dental hygienist also works in specialist environment. It could be periodontal clinics, oncology clinics, or other multidisciplinary teams in hospitals and secondary care environments. Also residential care or homes for the elderly or medically compromised. Also a range of other public health services the dental hygienist works within. The disparate nature of practicing environment means that the dental hygienist has an important and necessary role in both intra and interprofessional collaboration. At present, this element of training is underrepresented at most of the educations. One of the aim of the Common European Curriculum, the CEC, when the task force worked with this, it was also to ensure that this aspect formed a critical part of the new curriculum documentation. So let's look at the structure and principles of the Common European Curriculum. But before I present the education and the structure of the education, I like to be clear about a couple of things. The Common Education Curriculum is not a specific qualification, and it's not a European diploma, and it does not replace national training programs. Every country has their own law regulations and their supervising bodies. The CEC does not in any way interfere with national regulations on professionals. So what is it then? What basic competences and skills and knowledge do we believe the dental hygienists for modern oral health care need? Well, what we say is that this is a standardized curriculum approach that reflects the best academic practice for European dental hygienists. It also gives a possibility to refine and harmonize dental hygiene curricula across Europe. And it also enhances patient safety through a high standard of clinical and professional care. And we believe that the level of education should be on Bachelor of Science level. The 4 domains are built on the same principles and structures as the ADE, Association for Dental Education in Europe, the curriculum for dentists that was presented in 2017. The first domain is professionalism. and it is about ethics, law, professional attitudes, and behavior. This domain is based on the same principles as most of the healthcare professionals' curriculum. Professionalism is a commitment to a set of values, behavior, and also relationship, which underpins the trust the public hold in dental care professionals. Shortcomings within this domain are often responsible for patients' dissatisfaction, concern, and also complaints. And it emphasizes its place in the importance of embedding these values from a very early start within the curriculum. Domain 2, safe and effective clinical practice. It's about evidence-based practice, management and leadership, team working and communication, audit and risk management, education and training, and including CPD. Dental hygienists are required to ensure that they are capable of providing safe and appropriate care for their patients, of course. The care provided should be based on contemporary evidence wherever possible. And the quality of care and the management system that underpin it should be regularly audited and also improved. Domain 3, patient-centered care. Here we find the knowledge base, clinical information gathering, diagnosis and treatment planning, therapy, and also establishing and maintaining oral health. Patient-centered care is defined by the Institute of Medicine in 2011. And it says, providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring the patient values guide all clinical decisions. This means that a shared decision-making and support for self-care. Domain 4, oral health care in the society. There we find the dental public health, prevention and health promotion, interprofessional collaboration, and health advocacy. In addition to treating individual patients, a dental hygienist should be able to focus also on promoting health and implementing effective strategies of care. This necessarily involves understanding population demography and health trends in the context of the healthcare system or systems which we work within. You'll find this full curriculum at Wiley's online library, European Journal of Dental Education. And you can also find those documents on both EDHF and IFDH websites. I'd like to take this opportunity to thank the entire task force led by Professor Kerstin Örn from Sweden and the support from ADE and especially Dr. James Field from UK for their invaluable work with the curriculum. And also naturally project manager Corey Ljungblad for keeping the project together. EDHF also like to thank GP Oral Hygiene Products and IFDH for kind financial support in order to make this common education curriculum available in open access. Thank you to all of you. Thanks also to the EDHF Cooperate and Collaborations Partner for invaluable engagement. I have participated in lots of conferences, listened to brilliant, engaged and visionary speakers talking about the need for preventive actions in so many areas. In schools, at hospitals, in care dependence home, maternity care, young children, adolescents, the socioeconomic disadvantaged persons, and the need to close the inequality gap, etc., etc. I hear them talking about the need of more facts, more service, more data, and more money for research. And yes, we do need all that, and we do need to act and act now. But often when I leave a conference or when I close another article that I read, I am thinking, who is going to do this? Who will be there at the daycare center, in the schools, at the hospitals, along the bedsides? Who will prioritize time to work with the behavior change and attitudes towards smoking, diet habits, daily oral health care routines, and supporting the patients with chronic periodontal diseases? My strong belief is that the oral health care team really need to rethink how we can collaborate in the best interest of the patient, and by that also the society. It has been said many times, we can't repair us out from the burden of the oral health diseases. If we really want to contribute to a better oral health, we need a paradigm shift where prevention is always present. No restorative treatment should be done without a plan for sustainability. Sustainability for individuals, quality of life, for the society, the economical burden, but also for the environment. The most environment-friendly filling is the one that never will be done. The better the dental health, the less use and consumption of disposable materials, chemicals, materials, medicine, and energy. Those are aspects we need to consider, and why prevention and health promotion is so important for us. So, to conclude, what is a dental hygienist for modern oral health care? As I see it, it is a well-educated dental hygienist profession within the oral health care team, well known for politicians, for decision makers, and also other healthcare professionals. The dental hygienist should be a natural part of dentistry with high quality preventive oral health care, contributing to equal health in the society and cost-efficient use of resources. Dental hygienist is a reliable resource in both dental and interprofessional environments, visiting oral health care, primary care at hospitals, in rehabilitation, and with lifestyle issues. So let's start using this resource much better than we do today. Finally, I'd like to congratulate IFDH to their 35th anniversary in service of oral health care and dental hygienists. All the best for the future to all of you. Thank you for listening, and I hope to see you all at the virtual conference June 26th. Thank you so much.